Is haloperidol safe during pregnancy? When it comes to the safety of haloperidol, commonly known as Haldol, during pregnancy, many expectant mothers have questions. Haloperidol is a first-generation antipsychotic medication frequently used to treat schizophrenia. It works by blocking dopamine receptors in the brain, helping to reduce symptoms like hallucinations and delusions. However, the safety of this medication during pregnancy is a topic that requires careful consideration. Research shows that haloperidol is not typically linked to an increased risk of birth defects. However, there have been rare case reports of limb defects in infants whose mothers took haloperidol and other medications during pregnancy. It is important to note that these reports do not conclusively prove that haloperidol alone caused these issues. Some studies suggest that exposure to haloperidol during pregnancy may lead to adverse outcomes for infants, such as shorter gestational age and lower birth weight. These outcomes are often more closely related to factors like preterm birth rather than direct effects of the medication itself. Other factors, such as maternal smoking or substance use, can also contribute to these outcomes. When considering haloperidol, it does not seem to increase the risk of miscarriage, ectopic pregnancy, or stillbirth. However, using this medication requires careful management. For pregnant women diagnosed with schizophrenia, the decision to use haloperidol should involve a thorough discussion with healthcare providers. It is essential to weigh the benefits of managing schizophrenia symptoms against any potential risks to the fetus. Managing schizophrenia symptoms during pregnancy is vital to prevent relapse and ensure the well-being of both mother and baby. If haloperidol is prescribed, regular monitoring by healthcare providers is necessary to minimize any risks. In some cases, alternative treatments may be considered if the risks of haloperidol are deemed too high. In summary, while haloperidol is generally considered safe in terms of not causing birth defects, the potential for adverse outcomes like preterm birth means that careful management and monitoring are essential. Balancing symptom control with fetal safety is key for pregnant women dealing with schizophrenia.